Over the years, the systemic treatment in metastatic cancer helped improve the survival of patients. What is your opinion for the future research about the role of local control in metastatic breast cancer? Does subtypes make a difference?
Right. So, there are two approaches to local treatment, local regional treatment. One, of course, is the primary site, which we've been discussing. And the other is the treatment for the metastatic sites in women with oligometastatic disease. So at ASCO this year, you are probably aware of the BR002 trial that was presented, which was a phase 2 randomized trial that included some women. About 20% of women had de novo metastatic disease, and 70% of women had only one metastatic lesion. So it was really minimal metastatic disease. And in that trial, either stereotactic body radiotherapy, SBRT, was used to control the distant sites, or surgery was used. Mostly it was radiotherapy, not surgery. And the women who had de novo disease had to have their primary site controlled. So in the presence of primary site controlled and minimal metastatic disease, that study did not show any survival advantage for the use of SBRT to distant metastatic sites. So, I mean, that's not exactly the situation we're talking about, but the surprising thing about the result, well, not so surprising, I suppose, but similar to 2108 results, was that the local, regional plus systemic therapy arm, so the experimental arm, did extremely well, better than projected. So their survival was better than was expected at the time the trial was designed. The surprising thing was